Hello, everyone. So glad to be here this morning. Man, I was supposed to go live at 11:30, and I've just spent the last 22 minutes trying to fix the internet. So that's how it's going over here, which is fun. But nonetheless, at least it's working. Man, it makes you realize, especially when you run an online business, like no internet means I'm like stuck in the mud. I can't do anything. So I'm really, really thankful that it's back on and that we're good to go. And that I can be here with you, with all of you. So, hello, everyone. If you're joining me live today or if you're watching the replay, introduce yourself in the comments. Let me know where in the world you're watching from. And as usual, if there's anything that you want me to go back on, answer, any questions that come up, any information that you want to share, please, I invite you to drop it in the comments. Again, if you're watching live or if you're watching the replay, tag me in it. I always go back through and answer questions. And I want to make all of my talks as valuable as I can for all of you. So, to introduce myself, my name is Kimsey Berkwin. I'm an integrative nutritionist in my online nutrition and wellness practice called Progressive Health and Wellness, where I work with ambitious men and women who are struggling with their mental and physical health by taking a root caused body mind approach to optimize overall health. So today I'm going to talk about something that brings in, I would say at least 40, that number is probably closer to like 60% of my clients. It's one of the top 3 things that is bringing them in. You know exactly what I'm talking about when I talk about that annoying, uncomfortable feeling of being bloated. When your belly sticks out and you look and feel like you're 4 months pregnant, and it's just uncomfortable. It affects you psychologically because it changes, obviously how you look in your clothes. You might not want to wear certain clothes, but not the biggest thing is that it's just uncomfortable. So what am I talking about when I say bloating? I'm talking specifically about the distension, pregnant feeling bloating. But when I say bloated, some people, what comes to their mind is like water retention bloating, where they feel puffy. They might feel puffy around their abdomen too, but they also might feel puffy like in their face and their hands and their whole body. A lot of the information I'm going to share today applies to that kind of bloating also. But I want to be clear, I'm especially focusing on that distension, pregnant feeling bloating. So, my agenda today, and I should say, because I talk a lot about mental health. And if you're watching this on YouTube, I do have a private Facebook group. There's almost 4,000 of us in there, and it's called Holistic Solutions for Mental Health and Wellness. So I'd love to see you join us there. That's where I drop out the most content. But I talk a lot about the connection between gut health and brain health, and especially mental health. And so bloating fits into that. I mean, not only is it in the moment feeling bloated can make you feel depressed and irritated and anxious and like frustrated and all those things. But biochemically, when we start talking about some of the main culprits like histamine intolerance and gut dysbiosis and food sensitivities that can cause bloating, can also cause brain inflammation that therefore affects our neurochemistry and leads to the anxiety, depression, difficulty with focusing, brain fog, all those things. So my agenda today is to talk about the most common causes that I see in my practice that are associated with bloating. We'll talk about some initial nutrition recommendations, some like where I start my clients, but also different therapeutic diets that can be effective, depending on, of course, what is actually driving the bloating. Then we'll talk about lab testing that we use pretty frequently to uncover your root cause of bloating, and then some helpful supplements, mindfulness tips, things like that to help in the moment, help you hopefully feel less bloated, but also over time. Okay, and then lastly, of course, if you're joining me live or if you're here right now or if you're watching the replay, please introduce yourself. It's always so helpful to know who's here and how I can make these talks more helpful, more applicable for you. Okay, so first, actually, I kind of described it already. What is bloating? I always like to talk about the symptoms, but it's worth saying that bloating can often accompany other symptoms within the IBS umbrella, irritable bowel syndrome umbrella. So that could be like acid reflux. Some people might get acid reflux when they feel bloated, or vice versa. If they're starting to get reflux, it can trigger bloating. So, like regurgitation of your food or an acidic feeling coming up your throat, sore throat, mucus around the throat, hoarse voice, coughing, things like that. There can be changes in bowel patterns, like too loose of bowel movements, diarrhea, too hard of bowel movements, constipation, pellety, hard, or just skipping days. There can be nausea. There can be sometimes what I'll see is a pain or discomfort in the solar plexus or the upper right quadrant of the abdomen. That would give us an idea that there may be a stomach, gallbladder, pancreas connection to this bloating. Um, I think those are some of the more common symptoms: GI pain, discomfort, some of the more common symptoms that we'll see accompany bloating. So, when assessing bloating in my practice, first, I do want to get a full picture of the person's overall health, of course, but their digestive health too. That helps put the bloating into a context. So, do they have any of the other symptoms that I just described? Because that will let me know, give me an idea ahead of time, like right off the bat, what might be contributing to this person's bloating. Secondly, then we start looking at what the underlying causes may be. And I say causes, we often hear in the integrative health world, like find the root cause. And I say that all the time. Well, the reality is it's usually more than one, right? Not always, but usually more than one. So I'm going to say root causes. So let's talk about some of the main ones that I see. The first one definitely is food sensitivities. So, food sensitivity is different from an allergy. I have tons of talks on this that go in depth over food sensitivities, the mechanisms, the testing. So, go check out my Facebook group, search food sensitivities, and you'll find lots of content pop up on that, including why not all food sensitivity tests are created equal. But nonetheless, so food sensitivity is different from an allergy. It's mediated by a different, we'll just say, type of immune cell, an immune response. But the big things to take away are it can take up to 2 days for the reaction to a food sensitivity to show up. So if something that you're eating is causing bloating, you might eat bread, for example, on Monday and feel bloated on Wednesday, which makes it a lot harder to pinpoint. But nonetheless, so they're called delayed onset food reactions. Some of the big culprits that I see are gluten and dairy are the biggest, hands down. Corn and soy would be the next. Sugar would be the next. And then from there, I would say we get more nuanced. So, what I mean by that is like those foods tend to be, and oftentimes I I'll start my clients by removing those foods, and that helps tremendously with their bloating. For other people, we may need to look a little bit deeper beneath the surface. And this is where I'll start getting into histamine intolerance and SIBO, because in those cases, when we're looking at foods and how food might be causing bloating, it's a little different from a food sensitivity. So I'll get to that in just a minute. We'll talk about low FODMAP. We'll talk about low histamine. But nonetheless, I would say an anti-inflammatory diet that removes gluten, dairy, soy, corn, and sugar is a great place to start. It's also worth testing, considering testing for food sensitivities. I love the mediator response test. It's one of the most sensitive, accurate tests that we have available. And that will help because I've seen clients react to things like spinach and ginger that they absolutely, once they remove it, if they happen to eat it again, they notice it causes bloating. But it's the inflammatory response associated with the food sensitivity. So, what happens when you eat a food that you're sensitive to? Your immune system, another part of the immune system, comes in to destroy that food with chemicals. Those chemicals are called cytokines, and those cytokines are what cause our symptoms. not only bloating, but it can be other things too: joint pain, brain fog, insomnia, weight gain, water retention, IBS symptoms, you name it. But it's the inflammation associated with those food sensitivities that causes the bloating. So, food sensitivities are number one for sure. Second is where we look at dysbiosis. So, I'm going to lump H. pylori into that because for today's intent and purposes, H. pylori would count as dysbiosis. But dysbiosis it refers to an imbalance in the gut microbiome. So in the gut microbiome, we want a lot of diversity of microbes. We want just the right amount. We don't want too much and we don't want too little. And then we also don't want an overgrowth of what are called opportunistic microbes. That could be bacteria, yeast, or certain parasites. H. pylori I'll talk about in a second. But those opportunistics, they are normal to have, but they can generate inflammation and maldigestion if they're overgrown. And that's one form of dysbiosis that we look at. Is there too many? Are there too many opportunistics? Are there too little good bacteria? And so some of your food isn't being properly digested. Is there an overgrowth? There could be an actual infection that's causing inflammation in the gut. And then H. pylori, like I mentioned, H. pylori is a stomach bacteria. So it's bacterium that lives in the stomach. And when it overgrows, it interferes with our ability to produce hydrochloric acid. And low hydrochloric acid leads to maldigestion really down the rest of the digestive tract. And partially broken down food is the perfect fuel for bacteria. So it can also contribute to that dysbiosis further down in the small intestines and in the large intestines. Not to mention, H. pylori is also associated with acid reflux and gastritis and ulcers. So a number of things, but especially if you notice that you eat food and then it just like a normal size meal, but it just sits in your stomach like a brick. It just feels like it takes forever to digest. That can be one sign of low hydrochloric acid. And there's a possibility that's driven by H. pylori. It's also worth mentioning that H. pylori is a histamine producer and a methane producer. So it can slow intestinal transit. For some people, it can actually increase it because of the histamine. So methane slows, histamine increases. So there can be other bowel symptoms, and especially acid reflux or like stomach pain associated with H. pylori. But bloating is a very common one. Which leads me on to my next point, which is maldigestion. So maldigestion is another very common cause of bloating. Maldigestion, so I should say, the digestive process involves taking the food that you eat and digesting it into tiny, tiny, tiny subparticles, microscopic subparticles, so that it can be absorbed through the 20 some odd feet of small intestines. And then anything remaining gets passed on to the large intestines. This is mostly waste product that we couldn't use. There's some vitamins that will still absorb, some water that will still absorb. But for the most part, that waste product gets passed on to the large intestines. Bacteria eats what they can, and then we eliminate it in stool. So that's kind of the digestive process in a big nutshell. But if we don't properly digest our food into small enough subparticles, we don't get to absorb it. The bacteria gets to eat it. And when they eat it, just like you and I burp and fart and go to the bathroom, so do they. So they produce different gases, different endotoxins that then can contribute to us feeling bloated. So the first phase of digestion is actually called the cephalic phase, and it starts in the brain. So just being present with a meal, being hungry, smelling the food as it's cooking, that initiates the digestive process by up to 20%. We release saliva, hydrochloric acid, digestive juices. And then ideally, we thoroughly chew our food until it's liquefied, and then we swallow and it gets passed on to the small intestines. To the stomach. And then from the stomach, the that begins the chemical and mechanical digestion of food. Hydrochloric acid is really important for digesting protein, especially. But also what is now called chyme, that mix of food and acid, then passes on to the small intestine. And that acidity triggers the gallbladder and the pancreas to release bile and bicarbonate and pancreatic enzymes to then further digest the food in the small intestines. So this process of maldigestion, the digestive process, can break down in multiple ways. If we're not present with a meal and we're eating while driving or working or on the go, chasing after kids, automatically operating at 80% capacity. If we have H. pylori, if we've got a lot of stress, if we have nutrient deficiencies like zinc or iron, we're not producing enough stomach acid, so that will be a problem. Low stomach acid provides a weak trigger to the pancreas and gallbladder, so now that's a problem. And before you know it, you got this large food passing into the small intestines that's just going to feed bacteria and lead to bloating. So stay tuned. I'm going to get to what to do about that, some like basic things that you can do to support your digestion so that that doesn't happen. But just remember, maldigested food feeds bacteria, not us. Okay, and then am I on 4? We talked about food sensitivities, dysbiosis, maldigestion. So 4 is, I want to talk about SIBO and EMO. So SIBO, small intestinal bacterial overgrowth. EMO is intestinal methanogen overgrowth. Methanogens don't always have to be bacteria. They can be archaea, which is why these two things are differentiated. But they both involve an overgrowth of microbes in the small intestines. And through the mechanisms that I just described, when we have maldigested food, or in the case of SIBO, if we're eating FODMAPs, so certain types of fermentable fibers in food, that can lead to these microbes fermenting that food in the small intestines. And again, when they do that, they produce hydrogen and or hydrogen sulfide and or methane gas. And those gases get trapped in the small intestines and leads to bloating. So that's kind of, it kind of goes into the dysbiosis category, but I really think of those conditions as different. SIBO and EMO is a little bit different than just like general dysbiosis in the large intestines, but major causes of bloating for sure. SIBO and EMO make up, it's estimated 30 to 50% of all IBS cases, depending on the statistic that you read. And bloating being a big one of those symptoms. And then lastly is histamine intolerance. So histamine intolerance is where basically your body's bucket of histamine is overflowing. There's too many environmental factors triggering the production of it. That could be toxin exposure like mold or metals. It could be SIBO. It could be parasite infection or overgrowth. It could be dysbiosis. Could be high estrogen, low progesterone levels, but could be long COVID. It could be an infection. There's a number of things that are causing our overproduction of it. And we aren't great. The body isn't great due to like GI inflammation or poor liver detoxification at draining the bucket. So it causes histamine to overflow within the body. There are a host of symptoms that go along with histamine intolerance. So if you want to learn more about that, again, I'll redirect you to my group, Holistic Solutions for Mental Health and Wellness. Search histamine intolerance, tons of info. But nonetheless, there are histamine receptors in the digestive tract, the stomach, the small and large intestine, called H2 receptors. Pepcid, for example, the over-the-counter antacid, is an H2 blocker. So when histamine is in excess, it can trigger digestive symptoms, and bloating is one of them. So histamine intolerance is also a common cause of bloating. And these different conditions that I've mentioned kind of require different approaches. A lot of them will overlap, but they do have their nuances. So let's now get into that, how we test for these different things, some lab tests that we commonly run, how we can test for these individual nuanced things, and then some nutrition and supplement recommendations and lifestyle. So, lab testing. So, one test that I run on everyone because of the information that you glean from it is the GI map stool test. A comprehensive stool test is invaluable at learning about your health, specifically digestive health and the microbiome. But because digestive health is kind of the gateway to our overall health or disease, you learn a lot about a person's health and how to optimize it through a stool test. So the GI map stool test looks at what I consider the four pillars of intestinal health. First is the microbiome. So good bacteria, opportunistic bacteria, and other opportunists like Candida yeast or Blastocystis hominis parasites, but also bacteria. It looks at digestion and absorption markers. It looks at inflammatory markers and then overt infection, bacterial, viral, parasitic, fungal. It also looks at H. pylori. So we can find a lot of information in the stool test, both globally about a person's digestive and overall health, but especially any contributors, possible contributors to bloating. So I always start there. Next test to consider is a hydrogen methane hydrogen sulfide breath test. So a breath test will test for SIBO and EMO specifically. So I only run this test if I suspect those things are possibilities. I would need to see other symptoms other than just bloating, like IBS symptoms, acid reflux, nausea, things along those lines. But that test can be really helpful if we do suspect one of those conditions is occurring. A food sensitivity test is something to consider. I like running a food sensitivity test when I don't think these other conditions are happening, specifically SIBO or histamine intolerance. Because if I think one of those conditions is occurring, I would rather use low FODMAP or low histamine diet as opposed to testing for food sensitivities. But if not, if I don't think either of those things are happening, or if I think EMO is happening, and which doesn't respond to low FODMAP, then testing for food sensitivities could be really helpful since food sensitivities can cause bloating and they are sometimes hard to uncover on your own. So we'll look at the Oxford Biomedical Mediator Response Test or MRT test. Looks at 135 to 176, depending on which profile you use. Food additives and preservatives can really help us create a truly personalized therapeutic diet by removing foods that are causing you symptoms. Okay, and then lastly, so testing for histamine intolerance isn't great. There's one test that does look at intestinal histamine levels, diamine oxidase levels, and diamine oxidase, and lipopolysaccharide, which are inflammatory components of bacterial cell membranes. There's one test that looks at that. That can be helpful. You can test tryptase in the blood. You can test whole blood or serum histamine, but those tests aren't very reliable. So I don't typically test for histamine intolerance. Rather, we look at their symptoms, the person's symptoms, their history, and we'll implement like a low histamine diet. I do admittedly will often also remove gluten and dairy. Not only is dairy a histamine releasing food, but gluten is just so commonly a culprit in people and negatively impacting people's health that I'll remove gluten as well, and dairy and sugar. But low histamine, we're looking at high histamine foods like fermented foods, cultured foods, aged foods, and then also histamine releasing foods, which means those foods downregulate DAO levels in the digestive tract. Spinach, banana, chocolate, avocado, like I said, dairy products, certain nuts and seeds like peanuts, cashews, And then, like I said, kombuchas and vinegars and alcohol and think charcuterie board and wine, right? That's what I mean by fermented and aged and cultured foods. Um, but that can make a really big difference at supporting not only reducing someone's bloating, but reducing their histamine load too. Okay, next, and then like I said, if I suspect they have SIBO, I would use low FODMAP diet. And I mean specifically SIBO, so more of a hydrogen dominant diarrhea presentation, then I would use a low FODMAP diet, which has been shown effective in SIBO. Okay, let's see what else. So those are some of the lab tests, some of the diet recommendations. I will say, lastly, another diet recommendation is to space your meals out more. So start to avoid snacks, basically. So you can still have 3 meals a day, but start to aim to get 4 to 5 hours in between your meals and snacks. That supports what's called the migrating motor complex in the digestive tract, which is this cleansing wave-like motion that the intestines perform, but only after 4 hours of no food in the digestive tract. So, plus it'll really allow the stomach to fully empty its contents, and for the food to start moving through the first part of the small intestines before being filled again. Okay, some supplements that can be helpful. Of course, I have to say this really depends on what's causing the bloating, right? But some that we'll use in my practice are digestive enzymes, pancreatic enzymes where applicable. I often wait until we get stool test results back to test for that. But nonetheless, pancreatic enzymes can be helpful, helps you break down your food appropriately so it won't feed the bacteria. Hydrochloric acid, supplemental hydrochloric acid can be helpful. I'm giving my next week's live is on acid reflux. So watch that because I'll talk about, is your acid reflux caused by too much acid or too little acid, and a test that you can do and home tests, like all those things. But nonetheless, supplemental hydrochloric acid can be helpful. If you don't have histamine intolerance, drinking apple cider vinegar before meals can be helpful. So just a small, like a teaspoon of apple cider vinegar and like 1 ounce of water, swig that right before a meal. That'll prime the digestive tract, increase your acid production. So that can be really helpful. That can also be helpful if you're feeling bloated in the moment. So if you ate a while ago and you're still feeling bloated, just a small amount of hydrochloric acid, apple cider vinegar in warm water can help. Sometimes we will use antimicrobials if there is confirmed SIBO or confirmed dysbiosis or infection or something like that. There's a number of different protocols that I use, but sometimes antimicrobials can be extremely helpful. I like Cellcore's para products. I like Metagenics candibactins. So there's a few different ones that I use, but that can be really helpful, especially if SIBO is happening. It's a non-negotiable. We're going to have to use antimicrobials at some point. Diet alone won't fix it. Bile acids can be helpful too. Gallbladder, thickened bile or inadequate bile flow and excessive bile flow can cause bloating, amongst other symptoms. Excessive bile flow, we would not want to use bile. But if there's inadequate bile flow, then yes, we would. So that is where, that can be part of a full pancreatic enzyme blend, or sometimes we use it supplementally or we'll like differently, separately. Or sometimes we'll use something like TUDCA, which is a water soluble bound to taurine form of bile acids. And for in the moment feeling bloated, peppermint tea or peppermint supplements can be helpful, I've heard people have good results with activated charcoal. So any of those can be really helpful for like de-bloating in the moment. And then, like I said, if you don't have histamine intolerance, drinking the apple cider vinegar can be really helpful too. And then lastly, I always recommend presence with a meal. So eating in a calm, relaxed state, sit be seated, place both feet flat on the ground, take deep breaths in and smell your food. Really smell your food until you start to salivate. And when you start to salivate, you're relaxed, you're present. That is the cue to start eating. As much as possible, as much as you can control, try to eliminate eating while doing a million things, right? Eating while in a hurry, while driving, while stressed, while working, while any of those things, because it, like I said, you'll automatically operate at 80% instead of 100% capacity. So that's another really big one. Okay, I think that covers it. I do acknowledge there's some extra intestinal things that can cause bloating. High estrogen levels, for example, mold exposure. There are different things that can cause, nutrient deficiencies like iodine, for example. There are different things that can cause bloating that are extra intestinal, but I generally start with that list that I just described. Get the person's digestive and overall health in context, run some labs and figure out what's going on so that we can eliminate the bloating for good. Okay, everyone, what did you think of this? Was this helpful? What did you learn the most? What stuck out to you the most? Let me know, write it down in the comments. And if anybody is finally ready to figure out what's causing their bloating and be done with it, we do invite you to schedule a free 15-minute consultation with me. We just set up a call, talk more about what you're experiencing, what you're looking for. I'll talk about my practice and process. And if it feels like a good fit for both of us, we'll talk about what next steps look like. And if it doesn't, that's okay too. Okay, everyone, have a wonderful rest of your day. I'll talk to you soon. Bye.